Assalamualaikum warahmatullahi ta'ala wabarakatuhu. A pleasant day to each and everyone. So today in this video, we will discuss the chapter 8 of our book, which talks about the applications of epidemiology in community health. So previously naman sa ating CHN 1, okay, when you were your second year, okay, we had discussed the concepts of epidemiology. So, ngayon, pag-aaralan natin bakit kailangan ina-apply itong epidemiology na to and how is it applied in the community health. Okay, so although the beginnings of epidemiology might have been during the time of Hippocrates, when he explicated that disease could be associated with climate and the physical environment. It is still a young science that developed rapidly only after Snow's investigation of cholera epidemic in London in 1854. So, ang epidemiology na to, itong field na ito is masyadong bago. It is a young science, okay? Na which is nangyari siya in 18th century. Hindi siya masyadong well-versed na discuss, okay, or na improve at early ages. Okay? So, ano pala si epidemiology? So, etymologically, epidemiology originated from the Greek words epi, meaning upon, demos, meaning people, and logos, meaning study. So, several definitions of this field of study had been formulated, but the most encompassing is the definition uh, given by last, which states that epidemiology is the study of the distribution and determinants of health related states or events in specified population and the application of this study to the prevention and control of health problems. Again, it is the study of distribution and determinants of health related states or events. Okay, so yung mga distribution ng mga iba't ibang events na health related in a specified population, and also yung application ng study nito sa prevention and control of health problems. Bakit siya nakakatulong in preventing and controlling health problems? Once kasi na makita natin yung problem, okay, ma-identify natin yung mga health related events na yan, kung sino yung mataas, sino yung mababa, nagkakaroon ng direction yung goal ng ating services. Okay? So, a broader definition of epidemiology is described in Table 8.1, page 156. So, if it is study, it includes the surveillance, observation, hypothesis testing, analytic research, and experiments. If naman sa distribution, it refers to the analysis by time, places, and classes of people affected. Pag naman determinants, include all biological, chemical, physical, social, cultural, economic, genetic, and behavioral factors that influence health. Pag sabihin nating health-related states or events, these refer to diseases, cause of death, behaviors such as the use of tobacco, and positive health states, reaction to preventive regimens, and provision of or use of health services. Pag sabihin naman natin specified population, it include those with identifiable characteristics such as occupational groups and application to prevention and control. The aim of public health, again, is to promote, protect, and restore good health. So we have here next, let's discuss, okay, yun yung definition ng ating epidemiology. Now, let's discuss the practical application of epidemiology. So, the practical application of epidemiology as implied by the both definition of epidemiology and details shown in the table 8. So, ito yung way paano ina-apply itong field of study. So first, it is used for the assessment of health status of the community or community diagnosis. Okay, so ina-assess natin kung nasa good health ba yung health status ng community, okay, kung poor ba yung nutrition, kung poor ba yung iba't ibang health related events sa community. So second, it for the elucidation of the natural history of the disease. Third one is determination of disease causation. Number four, prevention and control of disease. Number five, monitoring and evaluation of health interventions. And number six, the provision of evidence for policy formulation. So each of these practical applications is discussed in greater detail in subsequent section, which is dito may kita sa page na ito. So hopefully this would make us understand that epidemiology is an important tool that is applied by the members of the community health management team, which includes the public health nurse, for performing their roles and function. So actually, in epidemiology, the nurse is the one who supervises all the activities. Okay? Ginagamit natin yon para ma-identify yung health status ng ating patient. And remember, in community health nursing, tayo ay nag-act as a supervisor. Okay? So, we have here on page 157 the types of health indicators and their examples. So, we have the health status indicators. So, ano dito tine-check yung morbidity, prevalence, or incidence. Pag health status indicators, which is the mortality, such as ang kasama sa mga mortality health indicator, we have the crude and specific death rates, maternal mortality, infant mortality, neonatal mortality, so on and so forth. Makikita mo lang yan or makikita nyo lang yan sa ating libro. We have also the population indicators, such as yung division ng mga female to male, okay, the population density, the migration population growth, indicators such as the crude birth rate, the fertility rate, the annual growth rate. And we have also the indicators for the provision of healthcare, such as the access to health programs and facilities, kung sino ba yung nakakatanggap ng mga health resources at saka mga health programs. We have also the risk reduction indicators, such as your mga number of children na fully immunized or fully vaccinated, people using treated bed nets, okay, yung mga breastfed na mga bata for first 6 months. We have also the social and economic indicators, such as yung distribution ng economic wealth, okay, types and levels of employment, the school enrollment, okay. We have also the environmental indicators, such as the potability of drinking water, chinecheck din natin yan, yung mga organic materials, kasi kailangan at the same time na monitor din yan. Remember na environment can affect the health of the individuals in the community. So we have also the disability indicators, yung mga tao na disabled, okay, binibilang natin sila. People who have chronic activity limitation or chronic mobility limitation. And lastly, we have the health policy indicators, such as the allocation of manpower and financial resources, the mechanisms for community participations, and the availability of public policy statement and health plan. Okay, so epidemiology is often used to describe this health status of the population through the estimation of health indicators. So, yung lahat ng mga nasabi kong health indicators and their examples, ang ginagawa natin sa epidemiology is nade-describe natin yung health status natin based sa estimation ng mga health indicators. So, these are just quantitative measures, okay, usually expressed in rates, ratios, or proportions that describes and summarize various aspects of health status of the population. So, dito hinahanap natin yung percentage, yung number mismo, yung ratio, okay, the rates, para lang ma-identify natin the overall health status of the community. So, health indicators, so besides serving as a tools for assessing the health status of the population, health indicators are also used for first, determining factors that may contribute to the causation and control of the diseases. Number two, identifying public health problems and needs. So, With regards sa ma-identify natin yung mga iba't ibang ratios ng ating health indicators, na-identify din natin yung mga problems na nangyayari sa community. We have also indicating priorities for resource allocation. We have monitoring implementation of health programs. Kasi namomonitor din natin doon at the same time kung well implemented ba yung health program. Kasi kung hindi, example lang, madaming namamatay na mga buntis. Oh, so ano yung problem doon? So siguro may problem with the implementation of the maternal program. Example din, may madaming bata sa community ninyo ang namamatay due to mga preventable diseases such as measles or chickenpox. Lahat yan siya may mga vaccines dyan. Pero dahil hindi na implement ng maayos, nag-fail yung ating community na maprotektahan lahat ng bata. So doon pa lang makikita mo na okay, there is a problem with the implementation of different health programs and also the evaluating outcomes of health programs. Okay? So, isa-isahin natin yung mga health indicators na pwedeng yung we need to look for. Okay, so we have first the morbidity indicator. So these are generally based on disease specific incidence or prevalence for the common and severe diseases such as malaria, diarrhea, leprosy, dengue, diabetes, and cardiovascular diseases. So dito hinahanap natin yung prevalence rate. Pag sabihin natin prevalence rate or prevalence proportion, it measures the total number of existing case of a disease at a particular point in time divided by the number at that point in time. So we have here, dito sa libro natin on page 158, makikita nyo dito ang ating formula for the prevalence proportion or prevalence rate. So P is equal to number of existing cases of disease at a particular point in time over or divide mo yan siya sa number of people examined at point in time times F, which F stands for your, where F is any number of base 10 that is used for multiplier to avoid having decimals as final value of the indicator. So, para dito sa ating prevalence proportion, tina-times natin siya usually for 100. Okay? So, times natin yan siya sa 100. Okay? So, we have also the incidence. Pag sabihin natin incidence, it measures the number of new cases, episodes or events occurring over a specified period of time, commonly a year, within a specified population at risk. So, it is the best indicator of whether a condition is decreasing, increasing, or remaining static. Kasi dito, tinitingnan natin kung ilang beses ba or how often siya nangyayari itong mga sakit na ito. So, doon natin na-identify kung very common ba siya o hindi. So, dito is yung incidence rate is derived from cohort study. So makikita natin on page 159 the formula for cohort or the incidence rate. Okay? So we have CI equals to number of new cases that developed during the period. I-divide mo yan siya sa number of person followed up and then times mo yan siya sa 100. We have also the, meron din tayo dito, another morbidity indicator, the attack rate, which is often used instead of CI, or the cohort incidence when the risk period of the occurrence of disease is very short. So we have ARs equals to number of people who ate the food item and developed diarrhea divided by total number of people who ate the food item ill plus well times 100. Okay? So, we have here also the factors that affects the prevalence. So, dinivide yan siya kung ano yung nagpapa-increase at nagpapa-decrease. So, siguro nai-increase yung prevalence rate because of longer duration of the disease or prolongation of life of patients without cure, increase in new cases, in migration of cases, out migration of healthy people, in migration of susceptible people, and improved diagnostic facilities. Nadidecrease siya usually ang prevalence rate na decrease siya due to shorter duration of the disease, high case fatality rate from disease, decrease in new cases, in migration of healthy people, out migration of cases, and improved cure rate of cases. Okay? So, we have here also the the incidence density rate or ID or IDR. So this is also computed using by total person time at risk for the entire cohort as the denominator. So dito din ang kanyang excuse me, ang kanyang formula. So ID is equals to number of new cases that develop during the period divided by sum of person time at risk times F or 100. Okay? So we have here table 8.3. The DOH or the Department of Health published the leading causes of morbidity for our particular year. So every year, every now and then, after kasi ginagawa kasi ng ating mga community health nurses is 'di ba na we do implement this epidemiology, ganito ganyan, nare-report natin yan siya, and then once na ma-report yan siya, it will be included in the report of overall na Department of Health, and then nakaka-release sila ng mga ganitong mga tables, okay? So, dito makikita natin na on 2005, we have the top 10 leading causes of morbidity, meaning mga nagkakasakit. So, pag sabihin natin morbidity is na yung inmorbid or may sakit. Pag kasi mortality, may namatay due a specific disease. So, ito yung mga diseases. We have the acute lower respiratory tract infection or pneumonia, bronchitis, acute watery diarrhea, influenza, hypertension, TB respiratory, diseases of the heart, malaria, chickenpox, and dengue fever. So, meron din tayo na morbidity indicator na specific morbidity rates which shows disease rates in specific population such as by age, sex, occupation, education, exposure to risk factors, place of residence, or combination of these factors. So, dito, ang specific morbidity, kumbaga hinahanap mo, okay, specifically, ano yung age, example, ang age group mo yung infant na may sakit na TB or may sakit na diarrhea. So, ganun yan siya. So, we have here dito yung mga TB cases as example lang ng ating age-specific rates for a disease. So, number of TB cases among those aged 20 to 24 years, and then the i-divide mo yan siya sa median population age 20 to 24 times 100,000. So, yung mga ganyang specific morbidity rates, tina-times natin siya, or yung F natin dyan is 100,000. Hindi siya 100. So, next, let's discuss naman yung mga mortality indicator. So, death. Okay, so ilan naman yung mga namamatay. So, we have here yung first is the CDR or crude death rate. This is defined as the rate with which mortality occurs in a given population. So, hindi siya masyadong specific. Kumbaga, ang binibilang na natin dito, ilan yung namatay sa isang community in 1 year. Okay? So, the number of deaths in a calendar year divided by the mid-year population times 1,000. So, factors that affect the level of CDR include the age and sex composition of the population, the adverse environmental and occupational conditions, and the peace and order conditions of place. So, this rate is called crude rate since the numerator and the denominator pertain to the total population and not to population subgroup. Kaya siya tinawag na crude. Okay? Crude rate. Okay? So, we have also specific mortality rates. Kung meron tayong specific morbidity rates, meron din tayong specific mortality rate. So, dito inaanap natin yung mga specific na number kung ilan yung namatay sa specific disorder. So, example, we have the specific mortality rate is equals to number of deaths in a specified group in a calendar year times the mid-year population of the same specified year times 100. So, we have also the cause of death rate, which gives the rate of dying due to specific causes. This is also a crude rate since the denominator includes the entire population. It can be made specific by relating the deaths from a specific cause and group to the mid-year population of the specified group. So ito yung formula. The number of deaths from a certain cause in a calendar year divided by mid-year population times F. Okay? So, andi dito din, okay, meron din tayo ditong table which is na-publish ng ating DOH. On 2006, we have the 10 leading causes of deaths or mortality. So, pinaka number one na madaming namamatay dito sa Philippines is diseases of the heart. The next is diseases of the vascular system. We have the malignant neoplasms, accidents, pneumonia, tuberculosis, chronic lower respiratory diseases, diabetes mellitus, certain conditions originating from perinatal period, nephritis, nephrotic syndrome, and nephrosis. So dito pa lang may kita natin na mostly ngayon ang major causes of death dito sa Philippines is mga non-communicable diseases or health-related lifestyle or lifestyle health related na mga disorders. So we have also the infant mortality rate or IMR, which is defined as the number of deaths of infant under 1 year of age in a calendar year per 1,000 live births in the same period. So andito yung kanyang uh, formula. IMR is equals to deaths under 1 year of age in a calendar year divided by number of live births, meaning yung mga naipanganak sa year na yon, times natin sa 1,000. So this is a good index. Kung tanungin natin ano yung good index of level of health sa community, ito yung isa dito is yung IMR. So because infants are very sensitive to adverse environmental condition, thus a high IMR means low levels of health standards that may be secondary to poor maternal health and child health care, nutrition, malnutrition, or poor environmental sanitation. Okay? So next we have the MMR or maternal mortality rate. Okay, so maternal death is defined as a death of a female from any cause related to or aggravated by pregnancy or its management. So example, hindi nakasama yung mga accidental ha na mga causes. Kumbaga, yung hindi due to accidents, iba na yon sa mga hindi na-anticipate ng ating health workers. So we have here the ano to, formula. Okay, number of deaths due to pregnancy, delivery per period in a calendar year divided by number of live births in the same year times 100. So we have also the case fatality rate, okay, which is the proportion of cases that end fatally. It gives us the risk of dying among persons afflicted with a particular disease. So dito hinahanap natin yung mga pwedeng rate o kumaga na magkakos ng death sa isang due to a particular disease. So number of deaths from a specified cause divided by number of cases of the same disease times 100. Okay? So next is we have the population indicators. So population indicators include not only the population growth indicators such as your crude birth rate, general fertility rate, and total fertility rate and annual growth rate, but also other population dynamics that can affect the age, sex, structure of the population, and vice versa. So example lang natin, we na under sa population indicators is the crude birth rate. So dito tine-check natin yung mga number. Okay, we have the formula number of registered live births in a year divided by mid-year population times 1,000. Okay, so we have also general fertility rate or GFR, which is a more specific rate than the CBR since births are related to the segment of the population deemed to be capable of giving birth, that is the woman in the reproductive age group. So GFR is equals to number of registered live births in a year divided by mid-year population of women 15 to 44 years of age times 1,000. Okay. So we have here may tinatawag tayong population pyramid which which is a graphical representation of age, sex composition of the population that should also be examined during the assessment of health status of the community. So dito, the shape of the pyramid provides insights into the fertility and mortality patterns of the community, as well as the most probable health problems that would likely need health services. So dito may kita nyo sa population pyramid example lang, we have on page 166, okay, may kita mo yan siya na example lang ng ating population pyramid. Okay? So, next, let's discuss naman yung mga sources of data for calculation of health indicator. So, ano ba yung, saan ba natin nakukuha yung mga data na yan para ma-calculate natin tong mga different health indicators. So, there are several sources of information for purposes of assessing the health status of the community. Many of these are large primarily in government agencies such as Department of Health. So, we have here ito on page 167, box 8.2, we have here the different health sources, okay? So, first, based sa census, okay? Siguro naman nakatry kayo na may nagvi-visit sa bahay ninyo, tinatanong ilan yung tao sa bahay, ilan yung bata, matanda, okay? Young adults, old adults, okay? So we have also the vital registration system. Okay, especially ngayon, 'di ba, meron na tayong national ID, so doon pa lang nakita natin kung ilan. Okay, we have also the disease notification, the disease registries, the surveillance system, hospital data, health insurance, school health program, downloadable data sets, and surveys such as pag nagbigay ka, nagbigay ka ng mga surveys and then tinanong mo yung mga morbidity, the demographic, and health. Okay? So, yan ang ating iba't ibang sources of data kung saan doon natin makukuha yung kailangan natin para makalculate at ma-identify yung mga health indicator rates natin. Okay? So, meron tayong tinatawag dito sa Philippines or another program of DOH based under sa epidemiology or surveillance. We have the Philippine Integrated Disease Surveillance and Response or PIDSR. So this integrates health statistics generated through the major disease surveillance teams in the country. So ito under dito sa PIDSR na to, we have the notifiable disease reporting system, we have the field health service information system, the National Epidemiology Sentinel Surveillance System, Expanded Program on Immunization Surveillance System, and we have also the HIV AIDS Registry. Okay, so yan yung mga iba't ibang pinagkukunan ng health data with regard sa epidemiology. So next, let's discuss naman yung ating considerations in the analysis of and interpretation of health indicators. So, because of the various sources of data for the estimation of health indicators that are used for the assessment of health status of the community have inherent strengths and limitations, these are the following points that should be considered when interpreting the health indicator. So, first, okay, meron tayong 5 dito na mga kailangan i-take consider natin once we interpret this health indicator. So first is the denominator of the rate the most appropriate one? So preferably it should be the population in which the events in the numerator are expected to or could have occurred. So make sure na you need to follow these the different formula. Sorry. Next is the numerator an accurate count of the number of events? Inaccuracies can arise due to under-registration, under-reporting, or duplication. So, make sure lang before mo siya i-calculate, walang hindi na i-report, okay, or hindi na register, or na-duplicate. Next, there should be a corresponds in time and geographical location of the events in the numerator and the population in the denominator. Next, time specification are usually on an annual basis. However, special indicators may have other period specifications and this should be stated. And lastly, the factor used in the computation of the different rates may be any any number of the base 10. Okay? So yan ang different considerations natin when it comes to analyzing and interpreting this kind of data. Kasi, alam natin kung saan tayo kukuha ng data, alam natin kung ano yung mga kailangan natin na data. So make sure lang na alam din natin how to interpret this one and analyze this one. Okay? So, next, let's discuss naman, okay, dahil dito sa epidemiology is mostly pinag-aaralan natin yung mga distribution of diseases, okay. So, pag-aaralan naman natin is the elucidation of the natural history of a disease. So, paano ba nakilala yung disease na ito? So, the natural history of a disease is its course over time starting from the pre-pathogenesis stage to its termination. While clinical data of the patients with various stages of the disease are usually put together to determine the natural history of a particular disease, a prospective cohort study could plot it better because of the benefit of observing cohort from the time that the members are disease-free to the time they develop the disease through its termination. So, yung pag-develop ng ating mga natural diseases, it start on the phase na wala ka pang disease hanggang sa nakuha mo yan siya, hanggang sa naka-recover ka, or either naka-recover ka or namatay ka due to a specific disease. Okay? So, uh, So, ani dito on page 170, the different stages in the natural history of the disease and the levels of prevention. So, it starts first with the stage of susceptibility. So, ito yung tinatawag nating pathogenesis stage. So, ikaw, kung nasa state ka na you are, poor yung immune system mo, okay, yung mga wala pang yung etong stage na to, yung wala ka pang sakit pero merong mga risk factors na nakikita sa'yo na pwedeng mag-develop into further or getting that diseases. After the stage of susceptibility, papasok sa stage of subclinical disease. So the person is still apparently healthy since clinical manifestations of the disease are not yet shown. Although, sa loob nito or sa katawan niya, meron ng pathologic changes. So, after the subclinical disease, we have the stage of clinical disease. So, meron na siyang sakit kasi lumabas na ngayon yung mga iba't ibang signs and symptoms. And then, after the stage of clinical disease, papasok na siya sa resolution stage. So, dito sa resolution stage, it's either nag-recover yung patient mo or namatay dahil sa disease or nagkaroon ng chronic case and nagkaroon ng disability or automatic namatay na nga. Okay? So, we have here the, determining the disease causation. So, there are different models na ginagamit natin para ma-identify ano ba yung nagko-cause ng disease. So, the multiple theory of disease causation has been depicted simply by the we have the tinatawag nating epidemiologic triad or triangle model. So, with the use of either one of two schematic presentation, which is makikita natin dito sa page 171, figure 8.3. Okay, ito yung tinatawag nating epidemiologic triad or triangle model. So, dito nakikita natin yung relationships ng causations of disease. So, we have the host, which is tayong human. The agent, it's either bacteria, protozoa, virus, kung ano-ano pa mang mga miniature dyan na mga microorganisms that can cause disease, and then the environment. Okay, so we have two. Dalawa yan siya. Okay? So, initially, the model was applied for the infectious diseases. So, the agent referred to the parasites, protozoans, bacteria, viruses, and other microbes. Later, as applied to non-communicable diseases, the agent was expanded to include nutritive factors and chemical agents or physical agents. So, the model suggests that the agent and the susceptible human host are interacting freely in a common environment. For as long as the balance is maintained or is tilted in favor of the host, okay, disease does not occur. However, when the balance is tilted in favor of the agent, kumbaga more in agent siya, which is yung mga microorganisms, nangyayari na mas may tendency na mangyari na magkaroon ng sakit. Okay? So we have here also another model na ginagamit din natin for the disease causation. So we have the wheel model of disease causation na makikita natin sa page 172, figure 8.3, 8.4. So ito siya basically the same as of the triad. Okay, the former gives emphasis on the role of the genetic makeup of the host that is presented as the inner core of the wheel's hub, and the outer core of the hub includes the host characteristics such as the sex, age, socioeconomic status, and behaviors. And the rim or the outer edge represents the biologic, physical, and chemical environment. So makita nyo magkakaiba. So we have the biological environment, social environment, or physical environment, and then sa next circle, we have the human host, and then pinakagitna is the genetic core. So, in contrast to the triad, the infectious disease for communicable diseases is part of the biologic environment along with the vector's animal reservoir of infection, the flora or the fauna. So, when non-communicable diseases became increasingly important as public health problems, the Webb model of disease causation was deemed applicable to capture the complex interrelationships of numerous factors, some of which increase the risk of disease while others protect against disease. Okay? So, yan yung mga iba't ibang models na ginamit natin para ma-identify natin ano ba yung nagkakause ng disease. Okay? So, first, yung mga triad na yon merong, kumbaga na, pina-represent na may balance between the host, the agent, and the environment. Pag mag-tilt lang siya or more on sa human host, okay, so malabong mangyayari na magkaroon ng sakit. Pero pag pabor siya, in favor siya with the agents, pwedeng magkaroon ng illness. And then itong sa wheel model, iba naman din kasi dito is ang daming mga factors na nag-contribute para magkaroon ng sakit ang tao. Okay? So, next, let's discuss the prevention and control of diseases. 'Di ba sinabi natin kanina na in the application of epidemiology, na prevent din natin at nakokontrol natin yung diseases. So, the field of epidemiology can be used to identify important public health problems of the community, to determine the magnitude and distribution of health problem in terms of who is affected and when and where the problem occurs, to elucidate the natural disease of or natural history of the disease, and to determine why the problem disease occurs, and to identify the factors that contribute to the disease causation. So doon, nakukuha natin lahat ng mga informations na pwede nating ma-utilize para makagawa tayo ng plan, protective, or preventive program. So, doon pa lang, diba, yung mga ganon na-identify natin kung sino yung naging health problem, okay, ano yung age na specific na target natin na at risk, ganito, ganyan. So, nagkakaroon ng plano. Okay, nakaka-establish ka din ng mga management mo na okay, ito yung gawin ko kasi dahil madami yung bata, I will focus on the nutrition or health ng mga infants by starting on the implementation of immunization. Magkakaroon ako ng mga health education classes which i-emphasize ko yung the importance of having vaccinated or fully vaccine, ganito, ganyan. So, doon pa lang, nagkakaroon ng guidance yung ating implementation ng mga services. Okay? So, next, let's discuss naman yung outbreak investigation. Okay, so the World Health Organization defines a disease outbreak as the occurrence of cases of the disease in excess of what would normally be expected in a defined community, geographical area, or season. Kumbaga na, yung ang nangyari is yung least expected mo nagkaroon ng outbreak. So, 'di ba katulad nung ating COVID, before siya nag-start as pandemic, nag-start siya as outbreak kasi hindi mo naman siya ini-expect na mangyayari. So, after noon nagkaroon ng outbreak dahil itong outbreak na to lumala ng lumala ng lumala hanggang sa buong mundo na yung naka-experience, tsaka siya naging pandemic. Okay, so yung outbreak investigation is very important or part of activity ng ating World Health Organization because dito na-identify natin or na-prevent natin at the same time yung mga diseases. So we have here the basic steps in an outbreak investigation. So first, you will operationally define what constitutes a case. Next, based on the operational definition, identify the cases. So after that, based on the number of cases identified, verify the existence of an outbreak. Next is establish the descriptive epidemiologic features of the cases. Number five, record the clinical manifestation of cases. And then number six, based on clinical manifestations, incubation period, available laboratory findings, and other information gathered, formulate a hypothesis regarding the probable etiologic agent, the sources of infection, the mode of transmission, and the best approach to controlling the outbreak. Next is test the hypothesis by collecting relevant specimens from the patients and from the environment. Number eight, based on the results of the investigation, implement prevention and control measures to prevent the recurrence of a similar outbreak. And lastly, disseminate the findings of the investigation through media and other forms to inform the public. Okay? So next naman, let's discuss the monitoring and evaluation of health intervention. So the plan for health intervention should include the plan for its monitoring and evaluation. Pinaka-importante kasama sa ating na-establish na plan is yung plano natin to monitor, okay, the status, overall status, kung ano ba yung ano yung magandang nangyari at hindi magandang nangyari, and the evaluation process. Kasi kung wala yan, yung pagmo-monitor at pag-evaluate, hindi natin malalaman kung nagkaroon ba ng effect yung mga services na binigay mo sa community. So, monitoring, let's define monitoring first. So, monitoring is an ongoing activity during program implementation to assess the current status of its implementation in terms of compliance to the design of the program, timelines, and attainment of midterm goals. Because successful attainment of the program objectives is dependent not only on the application of technical know-how and skills, but also on efficient utilization of resources, budget, equipment, and supplies. The latter should likewise be monitored. As a result of monitoring, the project management team is able to, okay, when we implement monitoring, nagkakaroon tayo ng assessment of the progress of the program implementation. Nakaka-identify tayo ng problems. Okay, we take, and then dahil na-identify natin yung may iba't ibang problems, pwede natin siyang i-correct on time. So we take corrective actions. Have a tool for quality assurance and management. Measure achievement of midterm program activities or objectives, and lay the groundwork for program evaluation. So yung evaluation naman is the process that systematically and objectively assesses compliance to the design of the program, the performance, the relevance, and success of a project, that is the extent to which the program accomplishes its intended results and achieve measurable impact. So, the primary purpose of evaluation is to provide feedback. Okay, nagkakaroon ng feedback on the results or outcomes and impact of the project in order to inform yung mga policy makers and planners natin about the efficacy of their intervention. So it answers, or yung mga in evaluation process, it answers the questions such as, did the program work as intended? Kung ano talaga yung goal mo, ano yung intention mo, yun ba yung nangyari? What results or outcomes did the program accomplish? What measurable impacts did the program achieve, or is the program cost effective? So whether the evaluation is done by an external or internal group, the principles of impartiality, independence, partnership, communication and coordination, credibility and transparency should be maintained. So kailangan yung mga mag-evaluate din hindi biased kasi nonsense din, okay? Ang pangit din, usually hindi tayong mga nurses or yung mga community health nurses, kung tayo yung nag-implement ng plan, hindi tayo kasama sa mag-evaluate. Kasi ano naman sa isa, syempre, ikaw talaga magiging bias ka. You will choose na naging effective yung resources or yung ginawa mo because ikaw yung gumawa. Pero kung iba yung nag-evaluate, nagkakaroon or natatanggal yung impartiality or pagiging nagkakaroon ng credibility yung evaluation mo. Okay? So, summary of this chapter. So, this chapter or yung mga na-discuss natin defines epidemiology and demonstrates its practical applications to the public health. So, this epidemiology is a powerful tool that can be utilized to take advantage of routinely collected health statistics as well as surveillance data for the estimation of health indicators. Much like a clinician who needs results of diagnostic tests to determine what ails the patient prior to administering a therapeutic intervention, a public health practitioners needs health indicators to assess the health status of the community. So pareho lang yung mga nurses sa hospital, tine-check natin every now and then yung kanilang mga diagnostic or lab results para makita natin kung ano, nagkaroon ba ng pagbabago. The same din dito sa atin sa epidemiology. So, nakakatulong to para ma-identify natin kung nag-improve ba or nag-increase, nag-decrease ba yung mga iba't ibang rates and ratios dito sa community. Okay? So we have here also review ano to, yung milestone okay ng ating development of National Newborn Screening System. 'Di ba meron tayong newborn screening, okay, which is yung piniprick natin yung heel ng ating babies and then chine-check natin for mga genetically metabolic disorders. Okay, para at least ma-check natin kung ano ba yung pwedeng kalalabasan ng bata. So, andito yung kanyang milestone. So we have 1996, 2000, 2004, 2005, and 2006. Okay. So I think that ends my discussion for chapter 8. Yes, chapter 8 to yeah. Okay, so chapter 8. So I hope na intindihan yung ating chapter 8. With regards sa ating chapter 9, it will be a reading assignment. Okay, so I want you to read on the chapter 9. Okay, so hindi naman siya masyadong mahaba kasi and also this are discussed previously naman sa ating CHN 2. Okay, kasi more on the healthcare delivery system. Okay, so again, we will have our midterm exam on Sunday. So, study chapter 5, chapter 7, chapter 8, and chapter 9. So, if you have clarifications regarding sa kung anumang activities na gagawin natin sa CHN, just PM me. Okay? So, thank you for watching this video or this audio recording or listening to this audio recording. And once again, wassalam.